Hi everyone, my name is Virginia Valentine and I'm going to present today on our poster titled Curriculum Development of Professional Wellness and Resilience Among Physician Assistants. Let me go ahead and share my screen so that you can see the poster. So let's start first with the introduction. Physician assistants have burnout rates of approximately 34 to 64%, which is comparable to other health professionals. This project was sponsored or funded by a HRSA grant that the PA program was awarded that included development of an objective in which they asked us to develop a wellness or burnout curriculum for PA students. This really was actually excellent timing because a new ARC accreditation standard came out requiring wellness curriculum. For many of you, a wellness curriculum was probably already part of your training program, but for PAs, unfortunately, this has not been a formal part of our training. So we're excited to share with you what we developed. This curriculum was developed with a committee that has spent approximately 1 year working on what we wanted in the curriculum and how we wanted to evaluate it. This group included myself, Virginia Valentine, I'm the PI of the grant, Katie Fortenberry, who's the co-PI, Jared Spackman, who's the PA program, Sean Curran, who's didactic faculty, and Amy Locke. We also consulted Michelle Vo, who was very helpful with her expertise in supporting us. Participants in the study, or in the project, I guess you could say, include all the students who are starting in May of 2020 in the PA program, which includes 68 students on our 2 campuses, both in St. George and in Salt Lake City. As you can imagine with COVID, really our timing could not have been better. I was worried before about developing this curriculum and whether or not it'd be well received, where in fact it was actually very well received and students were very engaged in what we had to provide for them. As you can see here, we had 3 goals. The first goal was didactic-based wellness skills. The second was enhanced peer support. And the third goal was improved access to counseling. So with goal 1, what we really wanted to do is really provide them with actual skills, teaching students about sleep health, finances, resilience, and mindfulness, for example. Goal 2 was developing a regular near peer support group. So what we have done here is we're putting students in small groups where they have a faculty member and they meet every semester or so, in which they talk about wellness and resilience and really just this transition to becoming a professional and becoming a physician assistant. And goal 3 was that we were lucky to be a part of the new embedded counselor who's going to be available in health sciences and accessible to PA students to try to increase their access to mental health services. So for evaluation for goal 1, what we wanted to do was compare the course evaluations. We already provide course evaluations, so this is for us a natural step to add this for the wellness curriculum and for us to understand what the students need. Goal 2, we're going to do a learner post-program self-assessment of the curriculum effectiveness, and so we can find out if the near peer support group is providing what they need. And goal 3 is utilization data. As probably many of you have, we have students report that they need to see a counselor, but we want to see if this increased access is something that actually they do utilize. All these goals will be measured in baseline as well as 6-month surveys where we really want to look at burnout, sleep, and stress. Again, I want to thank my group for working really hard on developing this curriculum. If any of you would like to have any more specific information, I'd be more than happy to share, and please reach out to me via email. Thank you so much.